Thank you very much for joining me. I'm Dr. Derek Da Silva. I'm the medical director of Common Sense Supplements. One of the hottest products today, and I have never seen anything like this in my 31 years of clinical practice and formulating products, full spectrum hemp oil. The main difference between hemp or full spectrum hemp oil or CBD and THC is this. Full spectrum hemp oil, which is, let's use those words, full spectrum hemp oil and CBD a little bit together, if you will. The difference between the two, CBD and THC, what's the difference? CBD, non-psychotropic, THC, you're going to get buzzed. It is going to have that psychotropic component. That is the difference. Comes from the same plant, the cannabis sativa plant. But the way the plant is grown, it is grown to either produce CBD or it is grown to produce THC. Various growing conditions, etc., is what dictates how that plant and what that plant is going to give you. So what do we use this for? Because you are physicians out there, I'm going to tell you the verbiage, and I'm going to give you the verbiage as exactly how I use it in my practice. Number one, it is an anti-inflammatory. It has COX-2 activity and it has LOX-5 activity, reducing pain and reducing inflammation. There are very few products that have that effect. Turmeric, by the way, is one of those products. Number two, for sleep. Folks, you gotta sleep. This is incredible for sleep. And for those of you that are doing hormones, pellets, etc., you combine a dose of the full spectrum hemp oil that we have, along with your progesterone before you go to sleep at night, it is unbelievable. Most of you are probably telling your patients to take your progesterone around dinner time. Perfect. You use the full spectrum hemp oil about a half an hour before you go to bed, and I promise you, you're going to sleep. Why? The sleep levels are deeper. Your dreams become a little bit more vivid. I've never had a problem sleeping, but I never remembered my dreams. I'm starting to remember my dreams, and I'm really liking them. I really am. Between the pellets and the testosterone and the dreams, baby, I'm good to go. So it's really, really good. And number three, we've got inflammation, we've got sleep, and what about anxiety? What about anxiety? How many people do we have in this country that are nervous and anxious? My top three uses for the full spectrum hemp oil: inflammation or pain, sleep, and anxiety. But what else do I use it for? I'm afraid to say this, but I'm going to. New Jersey has the highest incidence of autism in the country. 1 in every 35 boys in New Jersey has some form of autism or autism spectrum disorder. The results I am having in children and adults with autism is off the charts. I'm also using it in Parkinson's disease, benign essential tremor. Results, once again, are absolutely incredible. But I have to say, my top three still are pain, sleep, and anxiety. Now, a lot of people say to me, well, what happens if I take this during the day? Will I start to fall asleep? No, you will not, because this particular product, and most full spectrum hemp oils have adaptogenic activity, meaning the body will react and respond to the certain circadian rhythms and cycles within the body. How do you choose the right product? Folks, it all comes down to studies and bioavailability. I did the studies on our product. I know the bioavailability, and I also know how long it stays in serum. By the way, if you as a physician want to see the certificate of analysis to make sure that the THC levels meet the standards, which is less than 0.3%, we can send them to you. And very shortly, we're going to have a QR code on here so you can scan your phone and it will take you right to the certificate of analysis. One of the best things I've ever seen in my practice, and you need to try this. It is an incredible product. Safety, efficacy, it's all there. As always, thank you so much for joining me. I'm Dr. Derek Da Silva, and may you always be blessed with good health.